More than a month since our community was devastated by the 4th of July floods, and healing continues. If you have kids who have seemingly been affected by all that they've experienced, University Health has help. I'm joined by Sabrina Spencer. She is a clinical social worker at University Health. Thank you so much for being with us, as I think our community is going to have a really hard time recovering from what happened on the 4th of July. And that is why you're here today, to help us kind of cope as best as we can. And you also believe that this may be impacting our children very deeply.
Certainly, yes, and thank you for inviting me. So people can experience trauma in different ways. There is primary trauma, so children may have directly experienced the flooding. There's also secondary trauma, so children may be seeing the impact of the flooding on somebody they know or just on the general community. But regardless of how you experience trauma, it's normal for children or for anyone to show signs of stress after any trauma, especially in the first few months, so that'd be right now. Some of those signs that you may see in children are they may have memories or thoughts related to the flood. It's very common to show changes in sleep. For example, children may have trouble falling asleep at the usual time, staying asleep all night. They may have nightmares. Emotional distress is expected, maybe angry, sad, scared. And then in combination with emotional distress, it's normal for kids to have physical reactions. You might see them complaining of a stomachache or a headache. If they feel angry or scared, it's normal for them to maybe feel shaky, sweaty, restless.
Like anxiety a little bit, right?
Exactly.
Yeah,
yes.
and that just proves that trauma does impact children very differently, especially depending what age they are too, right? That is also a difference in how they can digest what has happened and be able to just kind of go on with their day. So I'm really glad you're here to address all of this. What should we do, caregivers, parents, if we need the support as well to help them?
Yes, so support's important for the whole family. Parents or caregivers might want to look for different signs, and depending on the age of the children, you may look for younger children under 6 to be showing signs of trauma in their play. That's a really actually healthy way for them to process the trauma. However, if you notice that that play is becoming really repetitive and they're still at that same level or more distressed, that's a good time to seek help. Some of your older children might be worried, they might be afraid, I'm going to get hurt, or somebody I love is going to get hurt. It's really important to provide them reassurance, information when they ask for it, stick to those comforting routines. And then you might notice some of your adolescents are more withdrawn, maybe more risk-taking or acting out behaviors. Again, very important just to provide that reassurance, that presence. I'm here, I'm ready to listen when you're ready to talk.
Absolutely.
If you need support, a good place to start if parents or caregivers want an evaluation by a professional is your pediatrician, your primary caregiver. They can provide referrals if needed. And then if they're looking for information, the National Child Traumatic Stress Network has free resources that tell parents this is what to look for in your kids and this is how to help, how to support them.
Well, that's a lot of resources and information you've given us, but the same thing goes if someone wants to see you, they do have to go through a primary care doctor.
So specifically for me at University Health, we're a level 1 trauma center. So if you happen to have received our trauma care at any point, I'm there for you.
Oh.
For university though, if you're interested in any of our resources, anyone's always welcome to come to us, to call us, and then we can explain how to access our different services. And our website is really good, not just for us, but you can put in any zip code and find resources for pretty much anything you're looking for.
Thank you for all of this helpful information today.
Of course.
After the break, the Dallas Cowboys were back in action this weekend. We're letting you know